So every time someone comes in, I'm just looking for and feeling for where their spine might have some vertebrae that are out of sorts, and really I feel like I can get a good handle on relieving their pain by just getting everything in a better alignment, get the movement of the spine obviously better. And I think as a result of that, we're going to see less nerve pain, less pinched nerves as you come in for. This is great just if you have any kind of sciatica, any other spinal disorders, even getting up to headaches, neck pain, shoulder pain. I think it all comes with the spine. And so I'm just feeling for where is her body not moving correctly? Where is the spine not optimal? Where is it stuck? And we just do this for a good, 10, 15, 20 minutes, whatever they need. And then once I start working here, we start addressing shoulder pain, neck pain. A lot of people just don't go to these areas. So like with my naprapathic sessions, I think I'm looking at just different areas that make sense to why this person's in pain, even if it's not so obvious. Like you can't just work into the area where the person feels the pain. That's not sufficient. And sometimes that's actually, that can be aggravating if the person's in a lot of urgent pain. So I've got to find this way to sweet talk the body, to think like a detective. And I always tell people I'm trying to find the criminal, not the victim. You come in talking about your right shoulder, that's the victim. But the criminal, the source, really might be lower on the hip, and it might be the complete opposite side. But that's what we're going after. What is the source of this person's pain? And so when I work on someone's neck, pain, or headaches, I just don't do any fast adjustments. That's not my thing. But I try to do like a really deep focus treatment into the musculature supporting the spine, into the bone itself. I'm working on the muscles, the tendons, the nerves. Because sometimes people ask me that. They're like, what is that? What are you treating? I'm like, really? I'm treating it all. And then I'm trying to work out that unnecessary tension so that your head feels lighter, you just don't have pain. This is great for shoulder pain too. We got to work on the neck with shoulder pain. But I think people can just sleep better and have less headaches if they're getting, in total, all of their neck musculature worked on.